Now coming on to the next question. So far we were discussing what is the basic content or what do you do to cause the regeneration or revascularization. Now what we are going to discuss now is when is or why is the regenerative endodontics done, or what is the major indication. Okay, you have already heard of the terms like apexification, apexogenesis, and now it's the revascularization, which comes under regenerative endodontics. So let's understand what is the difference. What is the significant difference between apexogenesis and revascularization in regenerative endodontics? Now to explain that, I'll give you some outline, basic outline to understand it. Okay, you know that we have got three procedures related. Okay, one is apexogenesis. The next is apexification, and as I've told you, now we have got revascularization. So when is it done? So certain conditions has to be met for these to be done. That is apexogenesis, you need some vital pulp. Okay, some vital pulp which will allow. So for example, if you have got this as a incomplete root development, apexogenesis allows the completion of root development if there is some vital pulp inside. Okay, now, so that is one condition. Now what you have next is apexification. Okay, apexification is just a calcific barrier. There is no continuous root development, and here usually you have a kind of necrotic pulp. So instead of what you have in this same picture, instead of continued root development, what we have is a calcific barrier being formed, and the reason being we have only a necrotic pulp. Now what exactly is done in revascularization? You can see technically it's combination of apexification, apexogenesis in understanding. That is, we have a necrotic pulp. We don't have any vital pulp tissue out there. Okay, and what we do is we help in continued root development. Okay, root development along with the development of new vascularization. Okay, new blood vessels are developed and the pulp dentine complex is also developed. So what happens technically here is the same thing, the continued root development, but as there is no vital tissue, we have to cause the revascularization, or we have to first do is revascularize, and this revascularization allows the stem cells to come there and help in the development of the root dentine complex. Now let's come to the question. So what is the difference is the question all about. Apexogenesis encourages continued root development in necrotic pulp. No, it needs the vital pulp. Okay, some vital pulp is needed. Revascularization encourages root development in necrotic pulp. Yes, that's correct. Revascularization attempts to create hard tissue barrier. No, actually revascularization allows to development of the or further development of the root. The calcific barrier, hard tissue barrier, is by apexification. Okay, revascularization uses calcium hydroxide as a primary source. No, we need stem cells, as I told you, we need a scaffold, you need a medium. So all these are used, and here we use basically the prime thing is majorly. I'll come to the further details how it is being done. Okay, otherwise I'll confuse you. So hope you understood. So far we have understood that we are using a triple antibiotic paste, isn't it? Triple antibiotic paste to disinfect the canal. So let's stop it there. So the correct answer for this is B. Revascularization encourages root development in necrotic pulp cases. Okay, so now coming on to the next part, next question in fact. So it's a clinical based question on, let's see what is the answer. 11-year-old patient presents with pain and swelling in the region of immature, now this is important, immature maxillary central incisor. So usually what we know, apexogenesis, apexification. The tooth exhibits mobility and sensitivity. Okay, let's see. There is periapical problem. So radiographic examination also reveals there is an open apex, understandably. Okay, now, okay, there's a small problem here. 11-year-old. Okay. Let's consider this to be a 9-year-old, which will be a much better option. Okay. So open apex and significant periapical radiolucency. So as I've told you already, we have mobility and sensitivity to percussion. So there will be periapical radiolucency. The tooth does not respond to pulp vitality test. Okay. So this is where the one thing is, it's immature. Okay. The first and foremost thing you understood here is it's an immature, where is that? Yeah. Immature maxillary central incisors, and it's an open apex as a result. And we have, so it's two things, immature, open apex, okay, and we have doesn't respond. So usually what we do, open apex immature, non-vital, we do apexification, but now we can go for this revascularization. Okay, if it was vital, we could have done apexogenesis, but then why do you want to do apexogenesis when you can do revascularization? That's the question, isn't it? But then revascularization is definitely costly. So still, in a technical point of view, if you have an open apex, if you have vital tooth tissue, you can still go for apexogenesis rather than revascularization, considering the fact that it is much more economical and less technique sensitive. Okay, so non-vital, open apex. Yes. What we'll do? Perform apexogenesis? No, it's non-vital. You can't go for apexogenesis. Apexification could be done, as I've told you. But then why do you want to create simply a calcific barrier when you can simply induce, or cause revascularization by inducing bleeding? We saw this. Okay. Inducing bleeding into the canal, create a scaffold for new tissue growth. Yes. Extract the tooth? No, never. So answer is C. So hope you understood the indications part of it, isn't it? Indications of the revascularization, which is to be understood. Okay, so that will be the understanding of when this has to be done. Majorly non-vital, immature teeth. Now, studies say that up to 40 years you can do this. It doesn't need to be like an open apex immature teeth. Up to 40 years of age, researchers have shown that you can do it. Now, after 40, the book itself says that, okay, no much researchers are available. Okay, so endodontists, when you take your PG, please note, you can consider this. Okay, fine. So that's it.